Hello, everyone. Thank you for joining me today. I'm Dr. Castelblanco, one of the pediatricians for the Facey Medical Group. And today we're going to talk about a few important topics in pediatric healthcare. So we're going to be talking about asthma and allergies and eczema. Oh my. So here are some of our board-certified pediatricians and nurse practitioners. I'm on the right here. This is part of our Mission Hills clinic, but we have clinics in several different areas. We have clinics in the San Fernando Valley, in the Santa Clarita Valley, and also in the Simi Valley. So let's get started. So this is the Allergic Triangle. So as it says here, people that have one atopic condition are more likely to develop another atopic condition, and the trigger factors for each may be the same or similar. So all three of these, allergies, eczema, and asthma, often travel together, and they're called atopic conditions. Just because you have one of these conditions doesn't mean that you will have all three, but again, they do tend to travel together. So a little overview, we're going to be talking about asthma, signs and symptoms of asthma, how to treat it, how to prevent it, and most importantly, what to do during an asthma attack. For allergies, we're going to focus on environmental and seasonal allergies, or what we call allergic rhinitis. I will touch briefly on food allergies and hives and the most severe form of allergic reaction, anaphylaxis. We're also going to be talking about eczema, which is a skin condition, prevention and treatment for that. So asthma. Asthma is an inflammation of the lower airways. So as you can see in this picture, on the left side you can see the normal lung, what it looks like. And then on the right, this is what the lung looks like during an asthma attack. So there's three things that happen. There's inflammation, which is the swollen lining inside the airway. The muscle also tightens around the airway. Obstruction, which is when there's excess mucus inside the airway and that clogs the airway, making it difficult to move air in and out. And then lastly, hyperresponsiveness. So this just means that the airways are sensitive, and when there's an allergic trigger or an asthma trigger, airways in a child that has asthma are going to respond a little bit more severely. So what is the cause of asthma? We don't know. There isn't one specific cause, and we can't predict if a child is going to have asthma. But we can talk about the symptoms and things to look for, and of course, if you have questions about whether your child has asthma or not, I do encourage you to talk to your doctor about that. Some common signs of asthma. So the first thing we think of is wheezing. So wheezing is a whistling or squeaky sound that can be heard when you breathe. It's usually heard with a stethoscope in the office, and it's the sound caused by those narrowed airways. In a very severe asthma attack, you can hear the wheezing without a stethoscope at times. Kids can also have coughing, chest tightness, and most importantly, trouble breathing or shortness of breath. You'll see kids having fast and shallow breaths. They will also exhibit something called retractions, which are the muscles underneath the ribs and between the ribs sucking in. So that's not normal, and you can see that. The third is nasal flaring. You can see their nostrils flaring in and out a whole bunch when they're having some difficulty breathing. So those first three things are definitely things to look for in small children that can't tell you when they're having trouble breathing. They can't verbalize it, but those are signs for you to look for. And then older children can just tell you if they can't breathe or if they're having trouble breathing. And they may even have some difficulty speaking. Some types of asthma, it's a little bit more complicated than this, but I'll separate it out into intermittent, versus persistent asthma. So intermittent is just what it sounds like, asthma symptoms that are mild or happen infrequently, usually only with an illness, so when they get a head cold, usually does not interfere with their daily activities. And these children usually need an inhaler, but only on occasion. For example, when they get sick with a cold, they might need their asthma inhaler to get through that. And then persistent asthma, it varies in severity. It can be pretty mild, moderate, or severe, but persistent asthma has more frequent symptoms. You'll often see a pattern of more visits to the urgent care or emergency departments and requiring breathing treatments. These kids can have a decrease in their daily activities due to the asthma, and it can require 2 different medications. Again, I'll say this multiple times, talk to your doctor before starting any medications, but these kids usually require a controller medication, so a medicine that they take every day to prevent the symptoms of asthma. And in addition to that, having that inhaler, which is called a rescue inhaler, in addition to the controller medication for when they are having symptoms or when they're having an asthma attack. A third type of asthma I'll mention is the exercise-induced asthma. And kids tend to have symptoms just with exercise. They can feel chest pain, chest tightness, coughing, short of breath. These children tend to have less stamina, so they can't keep up with their peers, for example, with their physical activities when they're running, and they have some trouble with that. It is more common in teenagers. And it's treated with similar medicine with a rescue inhaler, but taken 30 minutes prior to exercise to try and prevent those symptoms from coming on. So let's get into the treatment. So treatment varies by child, depending on what kind of asthma they have. So again, talk to your doctor if your child has asthma and talk to them about which kind of asthma they have and what treatments may be appropriate for that kind of asthma for your child. So we'll start with the most basic thing, the rescue inhaler. So this is the quick relief medication. Medication is called albuterol, and there are many different brands out there. On the right-hand side, I've depicted just a couple brands that are popular, Ventolin and ProAir. The idea is that it rapidly relaxes the muscles of the airway so that your child can breathe. Usually you only have to use them once in a while, but you take this inhaler when you're having symptoms during a flare-up, and that helps to open up those airways quickly. It can cause an increase in heart rate. I just mentioned that, so it's not a surprise. That's not dangerous, but that does tend to happen with the albuterol inhaler treatments. Now, a long-term controller medication. So these are usually inhaled steroids. Again, there's several different brands. A few of them I've listed here. But a controller medicine is a medicine that's taken daily, usually when children are having frequent symptoms and we're having difficulty controlling the symptoms just with the quick relief rescue inhaler as above. So these medicines usually are taken 2 times a day, every day, whether they're having symptoms or not. The idea is that they decrease the baseline inflammation of the lungs to then control and hopefully prevent future symptoms or making the episodes less severe. So as I mentioned, it is recommended if your child is having frequent asthma attacks or several severe episodes in 1 year. It is recommended that after children use these inhaled steroids to rinse out their mouth or brush their teeth after use so that it's not sticking to their teeth or their gums. Asthma and allergy triggers. So I put these together because they're similar, the same for both asthma and allergy, the triggers. So there's environmental triggers, which are dust, cockroaches, pollen, mold. Other things can trigger an asthma attack, such as changes in weather, or if you have allergies to cats, dogs, other things outside like trees and grasses. or a big one is air pollutants, and probably the biggest one to avoid is cigarette smoke. Exercise, as I mentioned, can be a trigger for some children. And then respiratory illnesses, another very big trigger in children with asthma who have a cold or they get influenza, a respiratory illness, tend to have an asthma attack quicker. So how can we prevent these symptoms? First of all, taking the medications as prescribed. So I encourage you to talk to your doctor about what treatment is right for your child, as it is different for everyone. Avoiding the triggers that you might be able to identify. So one thing is to remove the carpet in the child's room because that tends to trap a whole bunch of dust. And then by removing that, that might be something you need to do. If your child is allergic to the pets in the home, trying to have them away from their room. And then, of course, regular follow-ups with your doctor. I recommend a follow-up for asthma at least every 6 months. Check in with your doctor during your child's wellness visit, and then if they feel like they need to see you more frequently or less frequently, you'll discuss that with them. And then I'll also mention getting a flu vaccine. Very important for everyone, but especially in children with asthma. Children with asthma are at a higher risk of complications from influenza. Children less than 5 years old in general are also at higher risk. So something very important to get your child their flu vaccine once flu season rolls around to try and prevent them from getting influenza and having a bad asthma attack with that. So how do I know if my child has asthma? Well, again, talk to your doctor about signs and symptoms that you may be worried about, that you may have seen. But some things to look for is if your child tends to have wheezing with illness or with other triggers, like we mentioned, things in the environment or cigarette smoke, pets. If they've had a pattern of difficulty breathing, requiring breathing treatments, if you've needed to take them to the urgent care or the emergency department because of their trouble breathing. If they have symptoms with exercise, or if your child has allergies that tend to trigger difficulty breathing, they may have asthma in addition to just their allergies. Also, if there's a history of asthma in the family, just because mom and dad have asthma doesn't mean your child will necessarily have asthma, but it does tend to travel in families as well. So something to think about and something to bring up with your doctor. A few points about living with asthma. So not all wheezing means asthma. And not all asthma is severe. Some good news is that many children can actually outgrow their asthma. So there is some hope there. Make sure that you and your child know the name of the medications. It's very important that even when you're not around with your child, that they know which medications they're taking so that another adult can help them take their medications if necessary. And then also teaching your child how and when to use the medications. Again, when they're not with you, they need to be able to use their own inhaler. And then having that rescue inhaler available both at home and at school. So having it available at all times, because you never know when there may be a trigger present or for some reason they do have an asthma attack and they will need that rescue inhaler to open their airways. And then lastly, keeping track of the symptoms. That's a good way of showing your doctor how severe or mild the asthma is. So if you keep track of the symptoms, you'll be able to formulate a better plan with your doctor on what the appropriate treatment is. You can also keep track of the triggers. If you're unsure of what the triggers might be, keeping track of each asthma attack may reveal certain triggers in the home or the environment that then you can try and avoid. So I'll say this last, untreated asthma can be a big risk. So a few pictures on how to take the inhalers. So in the top left-hand corner, you have a small child, and she has and her parent is holding the inhaler, and it is attached to a spacer and a mask. So you'll see on the top right, that clear cylinder is the spacer, and the mask is attached to that. So all of that attaches. It's a much easier way of delivering the albuterol or any of the inhaler treatments to a small child, because you squeeze on the inhaler and then the child just breathes normally into the mask and the tube for about 10 seconds in order to get that medication into their lungs. And then depending on how many puffs, you might need to repeat that 2 or 3 more times. So then on the bottom left-hand corner, you see a slightly older child, and she does not need the spacer and the mask. So she is putting her lips right around the inhaler, making a seal, and then she has to squeeze the inhaler and inhale through her mouth at the same time and hold her breath for about 10 seconds in order to get that medicine in. So that takes a little bit more coordination, but older children can handle that. And then on the bottom right, we see a little girl using a nebulizer machine. And so she has a mask, and it is attached to a tube, and that tube is attached to a machine where you put a little liquid vial of the medication into the machine, and then that continuously aerosolizes it. And so this little girl can just breathe normally into the mask for however long the medicine lasts, and then get her treatment that way. So that's pretty effective, and you'll probably see that, see the inhaler treatments, or see the breathing treatments, administered that way in the urgent care or in the clinic or emergency department. So what to do during an asthma attack? Biggest thing is to open the airways. So an asthma attack, it's also referred to as a flare-up, an exacerbation, or an episode. But when I say attack, it implies that you need to take action right away. So number 1, help your child sit up straight, don't lie them down, and stay calm. If we can calm down their breathing, that might help. And then number 2, give them their rescue albuterol. So it can either be in the form of the inhaler or the nebulizer. So try to give them their treatment as soon as you can. If there's no improvement in their breathing within about 20 minutes, then go ahead and give them another treatment. If they're still not improving, increase the dose, meaning increase the amount in the nebulizer machine, or increase the number of puffs that they're taking with their inhaler. But if they're still not improving or they're worsening, call 911 or take them to a clinic or urgent care or emergency department, and don't delay. We need those airways opened. And then once you do see a doctor during or after an asthma exacerbation, depending on how severe it is, they may recommend some additional steroids. So not all asthma flare-ups are this urgent. This is just what to do in the event that it is something urgent. Most asthma flare-ups can be managed at home with the medications your doctor has prescribed. So keep that in mind. But it can be pretty severe, so when to call 911? If your child's face is turning blue, it means they're not breathing well, they're not getting enough air. If they're in severe distress, or if they're having so much trouble breathing that they can't talk, or you're giving them their inhaler and their symptoms are not responding, they're not getting better, or their symptoms are worsening, even if you're giving them their medication. Or don't hesitate to call 911 if you're worried at any time that your child might stop breathing during an asthma attack. So now we'll transition to the second topic that we're going to be talking about, allergies. So concentrating on allergic rhinitis, which are those seasonal allergies that affect many of us, with the sneezing, runny nose, nasal congestion. I mentioned seasonal allergies, but they can actually happen year-round. People can have coughing, throat clearing. As you can see in the picture on the right, that person is having tearing in the eyes, swelling inside the nasal cavity, and that those secretions causing a postnasal drip. So some signs to look for in your children that you can see visually as a sign of allergies. So in the top left-hand corner, you'll see the child having this darkness and a little bit of swelling underneath their eyelids. That can be a sign of allergies. And then in the bottom left-hand corner, the swelling underneath the eyelids can cause these prominent lines underneath the lower eyelids. Then the picture on the right shows a child pushing up his nose because it's itchy, and this causes a transverse nasal crease from that repeated rubbing and pushing up of the nose. We call this the salute sign. So just a couple things to look for. So how do we treat allergic rhinitis? So avoiding allergens if possible. So again, thinking about those triggers in the environment with the dust and other possible triggers. We treat it with oral antihistamines. Now, these are medicines you've probably heard of, Zyrtec or Claritin. I've written here the generic names for you to see. Both are long-acting medications. They're taken once per day. There's no evidence of tolerance with chronic use, so they are safe medicines to take on a daily basis if your child is having allergies. And of course, talk to your doctor to see if starting an allergy medication is right for your child. Another medicine that can be helpful are intranasal corticosteroids. The most popular one is Flonase, and it is a spray that goes right into the nose and each nostril once a day, and it creates a more localized reaction, especially if the symptoms are more of the stuffy and runny nose. That the Flonase can really help with that. Another medication I will mention briefly is called Singulair or Montelukast. It's a leukotriene modifier. It just means it acts in a slightly different way. I mention it because it is good for patients that have both allergies and asthma. So again, talk to your doctor to see if this one is right for you. So some allergic reactions. So I said we would briefly be talking about this, just a brief overview. So hives. I'm sure you or your child have probably had hives before. They're pretty uncomfortable. They're itchy, raised, well-defined areas of redness on the skin. There's several different causes. They can be caused by viral infections or exposures to allergens, so something you might be allergic to. Most cases do resolve on their own by taking some Benadryl, which is a short-acting allergy medication that is often recommended in these cases, taking a cool bath or applying some cool compresses to the skin. We do try to avoid steroids in these situations if the reaction is isolated hives, and they do tend to go away on their own despite them being very uncomfortable. So the most severe type of allergic reaction is anaphylaxis. It usually comes on quickly within an hour. Kids tend to have difficulty breathing, and that's why it's the most severe reaction. Hives do occur with this reaction 80 to 90% of the time. Kids can also have abdominal pain or vomiting with it. So if your child has had an anaphylactic reaction, means you probably took them to the urgent care or emergency department due to their symptoms. So the treatment is a medicine called epinephrine, and we have it in injectable pens called the EpiPens, and these are injected directly into the thigh. If your child is having an anaphylactic reaction, it is helpful to lay them down flat. That can be helpful. I do encourage you to take them into the emergency room or call 911 if they're having that trouble breathing. But the EpiPen, if your child has been diagnosed with a severe allergy, the EpiPen can help them to get through their allergic reaction. And so as you can see, kids that are a little bit older can self-administer the EpiPen. It is a single-use injection. If this is something that your child needs, make sure that your doctor or your nurse or your pharmacist shows you how to use it. It goes directly into the thigh. You just inject it like that. It acts quickly to open the upper airway and decrease that inflammation so that your child can breathe. So I'll briefly touch on some food allergies. This is not meant to be an extensive review of food allergies, but just a few points about them. Some of the most common ones are milk, egg, soy, wheat, peanut, tree nuts, and shellfish. They can present at any age, but they're more common less than 5 years old. About 6% of children will likely have a food allergy, but some good news is that over 75% of children with milk or egg allergies may outgrow those by 5 years old. If they have allergies to nuts and shellfish, they are less likely to outgrow those. I'll mention that the oral food challenge, which is basically just trying the food, that is the gold standard of diagnosis for food allergies. So if your child eats the food and has a reaction, if we can correlate that, then that's what we believe is that they have an allergy to that food if they have a reaction right after eating it. So how to prevent food allergies? We certainly can't predict if a child is going to have food allergies, but a couple of things that we can do is we can introduce solid foods to our children on the early side, so between 4 to 6 months old, starting slowly, but starting early with introducing some foods and introducing allergenic foods. So things like eggs and peanut butter. We do ask that you hold off on introducing whole milk until your child is 1 year old, but other foods like eggs and peanut butter, we can start them early, a little bit at a time, and that may help prevent them from developing an allergy to those foods. So allergy testing. I get a lot of questions about allergy testing, so I'll just mention this again briefly. It isn't typically recommended in most patients. Allergies, we can typically tell if a child has an allergy based on the clinical history. So if they've been exposed to something in the environment and they had a reaction, or they ate a certain food and they had a reaction. But sometimes allergy testing can be helpful, and we do have allergy tests that we can do. But these tests, so there's a skin prick test, there's also a blood test. So the skin prick test is depicted here on the right. It is a very uncomfortable test. The skin is pricked in multiple different areas with different allergens, and then depending on how big the reaction is, we can tell if that is something that your child is allergic to. This is a test that is typically reserved for the office of the allergy specialist. So we don't generally do the skin prick test in the office. We can do a blood test, but the blood tests have false positives, which means if the test is positive, it doesn't mean necessarily that this is a true clinical allergy. So for example, if the blood test is positive for peanuts, for example, but the child is used to having peanut butter, eating peanuts, and they've never had a reaction when they've eaten peanuts, then I wouldn't exclude the peanuts from their diet because they're clearly not having a clinical reaction to the peanut, despite the blood test being positive. When the blood test is negative, we can believe that a little bit more and say, okay, if you don't have a positive result, if it is a negative result, then you are likely not allergic to this food or substance in the environment. So again, it takes a little bit of interpretation, but they can be helpful. So they can indicate that there's a possible reaction, but we can't predict the severity of a reaction. So talk to your doctor about if having some allergy testing is appropriate for your child. So just some indications to think about where we do tend to recommend allergy testing. If your child is having difficult to control allergies, and asthma, or if there are specific food allergies we're looking for, or if they've had some severe allergic reactions, then those are reasons to look into potential allergy testing, whether it's at your doctor's office or in the office of an allergy specialist. So let's transition over to our third topic of today, which is eczema, or also called atopic dermatitis. So this is an inflammatory skin disease. It can be chronic or intermittent, meaning either they have it all the time or it kind of comes and goes. It's a dysfunction of the skin barrier. So as you can see in these pictures, it can be very dry, cracked, itchy. Some common areas are the creases of the elbows, also behind the knees, but it can occur anywhere on the body. You see the pictures on the right, the one in the middle, that little child has it on their face, and then the bottom picture on the right, that child has it all over their arm and on their chest as well. So what is the treatment for this? The biggest thing to do for eczema is to moisturize. So some basic management, using thick barrier creams daily. Every day, some of my favorites include Aquaphor, Eucerin, Aveeno, CeraVe, or Cetaphil. I'm sure there are others, but they should come in a very, very thick cream. The thicker, the better. And we want to apply these generously 4 to 5 times a day, especially during a flare-up. If not during a flare-up, you can calm down with it a little bit and maybe do it a couple times a day, but certainly when there's a flare-up of eczema, you have to do it many times a day to moisturize the area. Best time to moisturize is after taking a bath to lock in that moisture. And I encourage kids to take baths on the shorter end. For babies, applying a daily moisturizer can help prevent the development of eczema, so something to think about. Something that is also occasionally recommended are dilute bleach baths. Talk to your doctor to see if this is appropriate for your child, but you can fill a whole tub of water with a 1/4 cup of bleach, so very diluted, and have them sit in the bathtub and soak in the bathtub with a little bit of bleach 1 to 2 times per week for just a few minutes at a time. That may help to calm it down. And avoiding some triggers. So the triggers for eczema are very similar to the triggers for allergy and asthma. So if it's something that can be avoided, then do so to prevent a flare-up. So some treatments for when there is a bad flare-up and we need something more than just the thick barrier creams we can get over the counter. So steroid creams are what are typically used. We use them 2 times per day for 1 week during a flare-up, so when that skin is very irritated. So there's multiple kinds of steroids. I've just listed a couple here. So the hydrocortisone is a low potency steroid. You can get it over the counter. That one is safe for both the face and the body. Higher potency steroids such as triamcinolone, or ones that are prescription only, are too strong for the face. So those I would only recommend for the body. And again, we only want to use them for a short period of time, because if we use them for a prolonged period of time, they can actually start to damage the skin. So we want to use them for short bursts with flare-ups if we need them. Another very important thing is to control the itch with the eczema. Eczema can be very itchy, and if children are scratching and itching, then it can get worse. So taking Zyrtec or Claritin daily during a flare-up can be helpful to bring down that itchy feeling. We want to prevent children from scratching it too, not just because it can make it worse, but also we all have bacteria underneath our fingernails, and that bacteria can get underneath the skin, especially where there's dry, irritated, and broken skin, and then that can cause an infection in addition to having the eczema on the skin. There are more treatments for eczema out there, so please talk to your doctor about it. There are some non-steroid creams that are being approved for children. So again, you can talk to your doctor about those and see if they are available to you. There hasn't been a lot of research done on those yet, but more is coming. So this is just a brief, basic overview on treatment. One additional thing I'll mention is the use of a humidifier. So I always recommend for my patients that have allergies and eczema to put a humidifier in the room when they're sleeping. It doesn't have to be right next to their bed, but somewhere in the room, because the dryness in the environment makes allergies and makes the eczema worse. So by putting a humidifier in the room, that counteracts that dryness and may help to maintain that moisture of the skin a little bit better. So we talked about some triggers with allergies and asthma. So eczema, very similar. There is no one secret cause to eczema. Oftentimes we're looking for that one thing that is causing the eczema. But there's usually not just one thing. It is a skin condition, and we don't know exactly why it comes on. But all we can do is manage the symptoms and treat it as best we can, and avoiding some of these triggers. So if your child has a problem with their eczema when the environment changes, so with the weather changes, if it gets cold or if it gets hot, depending on your child, their eczema might get worse. Being exposed to the sun might make it worse for some people. And then also environmental allergies and food allergies. I get a lot of questions about this. Those can make it worse, but they're rarely ever the one cause of the eczema. And then having contact with different materials and products. So things like soaps, creams, laundry detergents, they can be irritating to the skin. So try and use products that are hypoallergenic and unscented, using mostly cotton products in clothes, towels, and bedding or blankets will help to reduce that eczema. So that's about it for today. Just in summary, we did talk about asthma. If your child is having trouble breathing, most important to get those airways open. Prevent asthma symptoms by taking your medications as prescribed and recommended by your doctor, and trying to avoid triggers that you've identified. And then for allergies, taking your medications if you need them and avoiding those triggers. And lastly, eczema, moisturize, moisturize, moisturize. And again, try and avoid those triggers. So some references for you. I'll point out the healthychildren.org reference. This is a great website for parents, and it has lots of information about all kinds of pediatric topics. And then if you have any questions, please talk with your doctor about these topics and before starting any medication. Every child is different, so your doctor will help determine which diagnoses and treatment strategies are appropriate for your child. Thank you for listening today.